to Simply Women's Health with CJ. Today we're going to talk about genetic testing in pregnancy. First things first, genetic testing is optional. If you don't feel as though it is right for you and your family, you absolutely can decline any and all genetic testing that is offered. If you do wish to have genetic testing, we're going to talk today about the different options that are typically offered in your early pregnancy. There's two basic categories. There's what's called aneuploidy testing, and there is autosomal recessive disorders. The aneuploidy is unique to this particular pregnancy. The purpose of aneuploidy testing is to see if you are at increased risk to have a baby with one of a number of genetic abnormalities. There are a bunch of different tests out there, so I won't go into detail as to all the different testing. Your provider should be able to tell you what they offer in their office. But the majority of it is done, they look at a number of different factors: your age, your weight, your ethnicity, whether or not you're an insulin-dependent diabetic. They look at the number of babies in your uterus. They draw your blood. All of this is blood tests only, and they measure some placental hormone levels. With some testing, they can also measure or detect some of the fetal DNA that is circulating within your blood system. They put all this information into a computer, they come up with the mathematical odds, and they figure out your risk for having a baby, again, with one of a number of major genetic abnormalities. This is what's called a screening test. This test does not provide a diagnosis. It helps us identify those women who are at greater risk. If this testing comes back abnormal, your provider may recommend you have more invasive testing, such as a chorionic villus sampling or an amniocentesis. Those tests are what are called diagnostic. They will actually give you a diagnosis, but this is not the platform to discuss that testing. That should be done with your provider in your OB setting. The other option is autosomal recessive disorders. These are genetic illnesses that are found in children. In order for the baby to have the disease, you and the father of the baby both have to be trait carriers. It's a blood test. We draw your blood and we see if you're a trait carrier. There are a number of different things we test for: cystic fibrosis, spinal muscular atrophy, sickle cell. These are just to name a few. There are some others out there that can be tested for. Again, that is up to your provider. They draw your blood to see if you're a trait carrier. If you're not, no big deal. You never need that testing again. You are not a trait carrier. If you happen to be a trait carrier for any of the autosomal recessive disorders, they will test the father of the baby to see if he is a trait carrier. If he is not a trait carrier, again, no big deal. Remember back to your Punnett squares that you learned in the 10th grade. If you are a trait carrier and he is not, the baby has a 50% chance of being a trait carrier like you or not a trait carrier like dad. If you and the father of the baby both happen to be trait carriers, again, going back to our Punnett squares from the 10th grade that we learned, this is an autosomal recessive disorder. So if both of you happen to be trait carriers, it's a little a, the baby has a 25% chance of having the disease. Cystic fibrosis occurs primarily in Caucasians. 1 in 25 Caucasians carries the trait. In the Hispanic community, it's approximately 1 in 56. In the African American community, it's approximately 1 in 83. Children with cystic fibrosis have thick lung secretions. They have digestive enzyme issues. They used to have a short lifespan, but now because of lung transplantation, they're living well into old age. Another very popular test is spinal muscular atrophy. SMA occurs in 1 in 10,000 births, so relatively uncommon. Children with SMA, their muscles don't develop appropriately. Over time, they lose the ability to walk, to crawl, to suck, to swallow. Eventually, they lose the ability to breathe. Without early intervention, these babies do not live past the age of 3. The key to early intervention is going to be early detection. We do that with the genetic testing. Again, if you feel as though genetic testing is right for you, please speak with your provider about it. If you feel as though it is not for you, you absolutely can decline this. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your service.